Hello everyone and welcome to my channel Doctor and White of the choice in the most common cases that are asked in the exam. So this video will be a kind of a testing video in which you can test your ability that how you have prepared for the pharmacology subject, and to test that I will be simply telling you about the case, and you have to tell about the drugs. Before me giving you the answer, you can pause the video and think about that, and for the answer you can play the video. So it will be a kind of a revision video. I will be simply telling you the case and the drugs so that you can make a quick revision. So let us start. So be ready with your pen and paper. So here we begin. So for the first case, that is acute bronchial asthma, we will be using salbutamol or formoterol. So basically salbutamol is a beta 2 adrenergic agonist and it will be used for the bronchial asthma. Next, for the acute gout, we will be using NSAIDs, that is non-steroidal anti-inflammatory drugs. All drugs we can use except the aspirin. And for the acute severe digitalis toxicity, we will be using digibin. So salbutamol is also known as bronchodilator and it is beta 2 adrenergic agonist. So the next case is acute severe migraine, and for this we will be using sumatriptan. Next, that is ADHD, that is attention deficit hyperactive disorder, and for this we will be using methylphenidate. It is very important drug for this attention deficit hyperactive. And for the Alzheimer's disease, we will be using donepezil or rivastigmine or galantamine. So in this, Alzheimer's disease is very important for the previous years. For the next case, that is anaphylactic shock, we will be using adrenaline, and we have a specific quantity for this type of case, that is 0.5 milliliters of 1 upon 1000 concentration of 1 molar. Next, for the antithyroid in pregnancy, we will be using propylthiouracil. Next, for the wide spectrum anti-epileptics, we will be using valproate. So for the next, that is bipolar disorder, mainly prophylaxis, we will be using lithium. And for the brucella, we will be using doxycycline plus rifampicin. And for the cheese reaction, we will be using phentolamine and tolazolene. Next, for the chemotherapy induced vomiting, the drug of choice will be palonosetron, and for the clonidine, that is rebound hypertension, we will be using phentolamine. So in the previous case also we have seen the use of phentolamine use. Next, that is cytomegalovirus, that is CMV. We will be using encyclovir, so it is important. Next, for the depression and neurosis, we will be using SSRI, that is selective serotonin reuptake inhibitor like fluoxetine. And for the dreamride, we will be using methotrexate. And for the drug induced Parkinsonism, we will be using benzoyl, that is trihexyphenidyl. Next, for the enteric fever, that is typhoid, we will be using ceftriaxone or cefixime or ciprofloxacin. And for the fibrinolytics overdose, we will be using EACE or tranexamic acid. And for the platyhelminthes, that is mainly cystodes or for the trematodes, we will be using praziquantel. Next, for the nematodes, we will be using albendazole. And for the giardiasis, amoebiasis, trichomoniasis, we will be using metronidazole. And for the herbs simplex, we can use valacyclovir or acyclovir. So next, for the hypertension in pregnancy, we will be using alpha methylodopa or labetalol, that is mainly the drug of choice. And for the hypertensive emergencies in pregnancy, we will be using labetalol. And for the hypertensive emergency, we can use nicardipine. And for the OAG, that is open angle glaucoma, we can use latanoprost. And for the postmenopausal osteoporosis, we can use biphosphonates, mainly alendronates. And for the postprandial hyperglycemia, we can use nataglide. And for the shock, mainly cardiogenic with oliguria, we can use dopamine, that is in the medium dose only. And for the steroid induced osteoporosis, we will use biphosphonates, that is alendronates. And for the surgical prophylaxis, we will be using cefazolin. And for the hypothyroidism, we will be using methimazole or carbimazole, and for the syphilis we will be using benzathine penicillin, and for the termination of PSVT we will be using adenosine. And for the toxoplasmosis in pregnancy, the drug of choice will be spiramycin, and for the treatment of PDA, that is patent ductus arteriosus, we will be using ibuprofen or indomethacin, and for the trigeminal neuralgia, the drug of choice will be carbamazepine. And for the hypertriglyceridemia, the drug of choice will be fibrates. And for the infantile spasm, the drug of choice will be ACTH, that is adrenocorticoid tropic hormones. And for the kala azan and mucormycosis, it will be liposomal amphotericin. And for the malignant hyperthermia, it will be dantoline, and for the neuroleptic malignant syndrome it will be dentoline. And for the mydriatic in adults or mydriatics in children, it will be, for the adults it will be tropicamides, and for the children it will be atropine. And for the OHA, that is orally administered anti-hyperglycemic agents in obese patient, it will be metamorphin. And for the influenza A, it will be oseltamivir, or for the malaria it will be doxycycline or mefloquine, and for the plague it will be doxycycline. And for the pneumocystis pneumonia it cotrimoxazole, and for the rheumatic fever it will be benzathine penicillin, and for the whooping cough it will be macrolides, mainly erythromycin. And for the partial or the focal seizures, the drug of choice will be carbamazepine, and for the performance anxiety it will be propranolol. So now we will see about the diabetes. For the diabetes insipidus, for the central diabetes insipidus, it will be desmopressin. For the nephrogenic, it will be thiazide. For the lithium induced, it will be amylorides. And for the diabetes mellitus type 1, it will be insulin. Type 2, it can be metamorphin. And for the ketoacidosis, it will be regular insulin plus IV fluids. And for the pregnancy, it will be insulin. So thank you everyone for watching this video, and by testing your ability to do the pharmacology cases and the drugs of choice, you know how much you have prepared for the pharmacology exam. So if you like the video, please subscribe to the channel and like the video. And we also have a recent video on the most important questions for the FMNG exams or the last minute revision for the anatomy, so you can go through these videos. I have been giving you this on the screen. So thank you.